Alright, going to do a screen record of myself making the bone reduction and separate surgical guide for this case. So there's going to be some implants placed in the anterior mandible here. As you can see, the bone is going to need to be reduced a decent amount over this. So what I'm going to do first is come up here to mandible, and I'm just going to make a guide directly on the mandible that actually has no holes in it. So drawing the outline right now, and I really over contour these. I know that's way deeper than what I would want whoever's doing the surgery to have to place that deep in the mouth and reflect that far back, but because you never know exactly how much guide you have to spare when making these cuts and still leaving some perimeter to the guide for strength, I like to just over contour this, and then if need be you can come back and reduce the borders and such after you've seen how much bone reduction is required. So there we go. I'm going to push create surgical guide. And here we have a guide. And what I'm going to do now is, in order to make this bone reduction cut, I need to be able to cut through both of these surfaces at the same time. Now there's a cut tool in Blue Sky Plan. It's located right down here, and I could make a cut right now, but I could only do it through one surface at a time. And that's less than ideal. So what we want to do is join these two together. So the way I'm going to do that is I'm going to go to Export Data, and I'm going to export both the mandible and the surgical guide simultaneously. And I'm going to call this combined. And then I immediately just pull it right back in. Import STL. And this is combined. Okay. I don't need to align this because it should already be in alignment, as you can see right here. So now the tubes have been turned back on, and I don't need the maxillary tubes on at this point, so I'm going to turn them off, as well as the implants. There we go. So the mandible and the jaw have been turned into a single surface, and what I need to do now in order to visualize where to make the bone cut is that I need to lower the density or the transparency on this so that I can see my guide tubes underneath. So I'm lowering the transparency on the wrong surface. So here we go, and now you can begin seeing these. And if I zoom in, I can begin now to see where I need to make this cut. So really, ideally what you'll want to do is you'll want to make this cut in between, and I like to go right about in the middle to leave my implants a little bit subcrestal still, but right in between the bottom of the guide tube and the top of the implant. Might turn that up just slightly more so you can see it. So now I'm selecting the combined model. I'm going to push cut, and I'm going to just do this in one large movement. So I push shift on the keyboard, and there we go. That's going to tell me the mesh cut has failed. That's not uncommon for that to happen. And what that means is that there's somewhere in this mesh now that is not watertight, is the way I phrase it. If I turn this down, you'll be able to probably see, and I might have to change the color to something a little bit more light. But right here, you can see there's just a few little holes in the mesh right there. Nothing major, but we're going to need to fix that. And the best way I know of to fix that is just to export it and then take it into Mesh Mixer or really any STL viewing software that can do repairs. But Mesh Mixer is what I'm most comfortable with. So I'm going to export it. I'll just replace the combined model with this one. override it, and now I'll open it in Mesh Mixer. Okay, so here it is, and now you can see a little more detailed where that failed mesh cut is. So how do we fix it? Go to Analysis, Inspector, Auto Repair All, done. Very, very easy. If you do see any little sharp edges like that right there, you know, we could use some of the sculpt tools in Mesh Mixer. I'm not going to go crazy on that, but I would like to get rid of this rough edge. I'm just going to be careful not to involve that bone surface at all. Okay, so I want to leave flush edges so that the surgeon knows exactly where to adjust that bone to, and that would be to bring it down flat and even with the edges of this guide. Okay, so let's export this again. Once again, I'll just replace that model. Okay, and I can get out of Mesh Mixer. Now let's go back to Blue Sky Plan. I don't need this one now because this one's the one that has the failed mesh cut, and so I'm going to get rid of it, and I'm going to import the STL of where it's been repaired. It'll always take you to this screen to stitch. If you've not transformed it or altered its position, there's no need to stitch. It should be right where you left it. So just cancel out of this. And there we go. Now the question becomes, how do I separate those back out? Because if I'm going to make a bone reduction guide and a separate drilling guide, I obviously need just the segmented jaw now, the way it's going to look after it's been reduced. I need an individual model of that. So the way I do it is I come up, I say duplicate, there we go. So now I have two of these. So on this one, I'm going to say isolate, and I'm going to isolate the mandible, the cut mandible. And now you see the guide disappear. That's great. On this one, we'll change its color. On this model, I'm going to isolate the reduction guide. And there we have two separate models which can be printed and used for this purpose. Okay, so that's done. I'm going to rename this reduced jaw. And now I can go back to my implant list, turn on the guide tubes. Wrong tube. And now you'll see that none of my tubes are impinging down onto the bone. And so now we can make a guide. I'm going to build it on this blue model, a mandible, lock the implants, draw the curve. And once again, I over contour this thing just because I know this material is very easy to trim and reduce borders on. And I'll generally print these mandibles and you know, the bone models and whatnot out as well, because it really helps, one, for doing just a dummy surgery if you'd like to, and secondly, just to help visualize and get in your mind about how much surgical access you'll have and need, and then you can make those adjustments on these borders accordingly. So create surgical guide. And here's the net result. So unlike some of the other techniques which would use a stackable guide, that's certainly possible, but it's actually a patent protected process. With this method, what we're going to do is just make an individual bone reduction guide, which would be the yellow one. place that on the mandible, table it down to even with these edges, and then that guide comes out, and this one will go on, and this one will only fit after that proper reduction has been accomplished. So relatively straightforward program. Only have to get out of Blue Sky Plan once, and that's if you have a mesh cut that fails. If you don't even have to get out of the program. So I hope that was helpful.